Thank you, and welcome everyone. So this is really about science and journalism, not necessarily science journalism. The emergence of the pandemic related issues as front page news has raised many questions about the ability of journalists to communicate complex scientific issues, as well as the ability of scientists to tell a good story that's exciting and accurate. It's also raised questions around the state of the public understanding of science and the responsibility and challenges each person has to ensure they're well informed. At the end of the day, it's the community that beats the pandemic and what decisions they make about their health and how they interact with others. You can have all the government policies you like, but if you don't have the engagement of the population, you can't beat it. It's been shown to be a fundamental and often underestimated cornerstone of outbreak control. So in trying to sort out what the right thing to do is, we are all exposed to so much information now. And with me today to discuss these issues are three eminent panelists. Lauren Gardner, to my immediate left, is a professor in the Department of Civil and Systems Engineering at Johns Hopkins University. And she is one of the architects of the famed Johns Hopkins COVID dashboard that reached international fame as a source of credible information on what's going on in the pandemic. Next to Lauren is Effie Simou, who's an associate professor of mass media and health communication at the University of West Attica, Department of Public Health Policy. And next to her is Ioanna Soufleri, who's a molecular biologist and is the chief editor of To Vimla's science supplement, weekly supplement for To Vimla newspaper. So we're going to have a bit of a structured discussion of the issues first, and after that I'd like to invite you all in the audience to ask questions or raise points that contribute to the discussion, and we can take it from there. So Lauren, I'd like to start with you. What have we seen and learned during the pandemic in terms of getting the facts out? I mean, really effective risk communication that's arming the public with the information that allows them to protect themselves and others. I mean, everyone became a science journalist during the pandemic within the mainstream media itself, and a lot of, we'll talk about this later, but it was all hands on deck, from political correspondents to business writers. And then we have this new phenomenon these last few years of the citizen journalists, where anyone, bloggers, social media influencers, they all played a role in giving information on the pandemic. Likewise, among scientists, all of a sudden the ranks of infectious disease epidemiologists seem to have swelled overnight, with scientists from even remotely related disciplines positioning themselves as experts on outbreak control, whether they were originally sought out for that or whether they took it upon themselves proactively. So what did we see during the pandemic, and what are the implications of what played out as far as the information environment?
Sure, thank you, and thank you for having me. It's quite a can of worms there. We've spent about the last 2.5 years now collecting, democratizing, and communicating data on COVID-19 for the world from Johns Hopkins University, and we've been communicating this information to the public, policymakers, and also the media. And I think that there's actually different communication strategies and different lessons to be learned for each of these different groups. I think the biggest lesson from 2020 was the value of information. This was, the time period of this new emerging pandemic. The dynamics were continually changing. The science was evolving. What we knew about COVID was something that was changing regularly. It was a time where we were limited in terms of what we could do about it. We didn't have vaccines yet. We were reliant on non-pharmaceutical interventions and policy. And so these are things like closures and mask usage and limiting social gatherings. And so what we were really reliant on was human behavior and people complying with recommendations and policies that were made when they weren't enforced. This was also a time where we know we were in a very polarized environment, and we saw a lot of politicization around public health policy. And so what was the most critical thing was having information available to individuals who are having to really make individuals for themselves to protect themselves and protect their communities. And we looked closely at this, and we saw, watching observed behaviors and looking at the impact that this had on COVID, we found, of course, that behavior did impact transmission. People staying at home, people not moving around so much did help. But what we actually learned when we did this study was that behavior actually led policy. That we looked at a lot of cities in the US, and we looked at what was going on with COVID, and we looked at behaviors, and we actually found that people were changing their behavior. People were moving around less, staying at home before policies in their communities were in place and they were told to do so. And I think this really, in early 2020, spoke to the value of public information being communicated. So that was great. What I think we learned after that was the harms posed by misinformation. Once we got into 2021, we entered this new environment where we knew more about COVID. We started to have more tools at hand, like vaccines, to protect ourselves. And unfortunately, what we started to see was, even though we knew more and we had more potential to reduce harm, we still were seeing a lot of it. And that's because there was a lot of misinformation circulating that was leading to people's behavior and choices to actually not take mitigation strategies that were recommended by sound public health guidance and policy. And these in particular were things like vaccine uptake. And so in the US alone, I think that we had hundreds of thousands of deaths that we could have avoided if more people got vaccinated, because more people were better informed. And so I think that we have, this positive role of information, this clear negative role of misinformation. And what we need to do is we need to better understand what drives that. And we've looked really closely at this, especially for vaccine hesitancy. What are the drivers of it? We know there's certain groups that are much more vulnerable to misinformation. And I think that what needs to be done is we need better tools and better data to understand who these vulnerable groups are, why they're making these decisions. We've looked at all sorts of different driving factors, and one that always stands out is political party affiliation. And this is something that we just cannot avoid, and so it's just clear that this polarization and the role of politics in public health decision making and public health policy is so central and such an important factor that that needs to be addressed. And then I think where this goes to your question is this is where information is coming, what impact information has. But I think what's really important is where this information is coming from. And this information should be coming from the science. And the science itself has been noisy and has been a challenge. And science evolves. And I think that one thing is the public needs to better understand what science is, and that science is something where we should expect change as we learn more, especially in something that's new. But like you said, not only did everybody become an armchair epidemiologist and an expert, but apparently all scientists also became epidemiologists in the last few years. And I'm an interdisciplinary science, and I see huge value in cross-disciplinary work and moving tools from one field to another. However, there is also potential harm. And so we've actually looked also very closely at the work that's been done in this space, specifically around modeling and forecasting COVID, and who's been doing this work, and studied hundreds and hundreds of studies, and found that one thing that was happening is that the actual experts in public health and modeling were not publishing papers because they were really busy working with the policymakers, working on response. However, a lot of people who were not involved in this space were publishing. So the actual literature out there, which the media and the public were relying upon, was coming from a very mixed group. And we looked at all of these studies and assessed them in terms of their quality and the features, and found that there was a real variability in the quality and lots of missing really important characteristics of these studies that had been done in the first couple years, especially of COVID. And this was work mostly done by people outside of public health. And so I think, again, there's a lot of value in moving across fields and moving new tools, but especially in a public health emergency, understanding kind of what science is coming from the experts and what isn't is something that's really important. And on top of that, there are these preprint servers, which is, have always been around, and they're a great way to get new knowledge out there quickly without having to rely on the traditional peer review process that takes a while. But that was inundated with science as well. And some of it was great, and some of it was just wrong, and it would never get through peer review. But the media and the public doesn't understand the difference in a lot of times. And a lot of times, these works were absorbed and communicated as if they were peer-reviewed new science. And so that was hugely problematic. And what we really need is this better science information ecosystem to figure out how to centralize and share this kind of information as it's coming about in a way that is more, I think, regulated and controlled. On top of all of this, of course, is not only are scientists able to create information and share it, but pretty much anyone can create information and share it, and that can spread. And so we have information coming from the sources where it should, and then we have information coming from, sources where it shouldn't. And all of this is circulating and picked up by everybody, and being able to weed through and tease through this, I think, is something that's been a huge challenge. So in the end, I think that what we really need is we need the advice to be coming from the experts, and they need to have a much more prominent role in communicating the science that's relevant. And I think to do that, they also need to take it among themselves, and people like myself included, to be more formally trained and willing to communicate, and to communicate directly to the public, to communicate with media, and to communicate with policymakers and other scientists as well.
Thank you, Lauren. That's really interesting what you were talking about with these preprint publications, because there's been for a long time a call for science to move through the system much more quickly. That especially in an emergency, an outbreak situation, access to that knowledge, you have to wait so long to go through peer review and everything that it's holding back response. And obviously, we've realized from the pandemic and maybe a bit before that it is a double-edged sword. But it leaves you with the feeling of whose responsibility is it now? Now we've had that experience and we've seen both sides of it, because there are definitely positives of it to get that out there. But with the caveats, it is a very nuanced, complex thing. And as you say, understanding of science and what science is, and the whole peer review, the value of peer review, and the value of that science pre-peer review and after peer review, of what gets shaken out of the system. Whose responsibility do you think it is to ensure that, or is it a communication problem, or is it the journals have to be doing something different to safeguard the quality of the science, or is it a communication issue where communicators have to do a better job on explaining to consumers of this information?
Yeah, I think the responsibility is on both sides. So we're pushing really hard on the science side with new guidelines around, if you want to do these kinds of studies, these are the characteristics and qualities that your studies should have. If you're going to put out modeling forecasts that say what's going to happen in the future, you need to be clear on what your assumptions are, what the frameworks are, that there's uncertainty. You're not making point perfect predictions about the future. That how do you evaluate your model and tell us how accurate it is, that you do performance evaluation correctly, that you evaluate it over, lots of points. So there's a lot of work on the science side. There was a lot of work in managing these preprint servers. So actually early on, we added a new layer of screening, which didn't usually exist, to try to mitigate what was getting through these, because there were some really harmful things coming through them. And so on one hand, the scientists need to be more responsible in terms of what they're publishing. And this is in peer-reviewed work, too. We found some real weaknesses. But on the other hand, I think that the people that are consuming that, and this is public, but very much also in media, should be better versed in the differences between peer-reviewed and non-peer-reviewed science, how to interpret this work, and I don't know if, are we talking about clinical studies, mathematical modeling? They're different, and it's hard. And I think that really what we've seen is that, scientists kind of have to become journalists, and journalists have to become scientists in some ways, so.
Yeah, thank you, Lauren. That actually brings me on to Effie, and what I wanted to ask you about is this whole issue of science literacy among the public. So, and obviously everyone plays a role in that, scientists, journalists as an intermediary, and the responsibility of the public themselves, each individual, to get the right information. So do you think the pandemic improved science literacy among journalists, first of all, and among the public? I mean, with all the sources of information at our disposal today, and the plethora of misinformation, as we've heard from Lauren, and even willful disinformation, how has the public done in literacy, and how can they stay literate when it comes to science information?
Okay, thank you much, Emma. Thank you all for having me here. It's very complex answer, so I will try to give some facts to the audience in order to decide, because I cannot answer yes or no. So let me start first with some explanation of the definition of what is science journalism and what is science literacy. So, science journalism conveys reporting about science data, and results to the public. And science literacy is the ability of individuals to access, evaluate, understand, and use science data and information in order to make decisions based on facts and research, not on opinions. And we have to understand that it's completely different, the terminology of data, information, and opinions. So at the heart of science journalism is a focus on evidence. I believe that one of the hardest lessons journalists have learned while reporting on COVID-19 was how to communicate absence of evidence, scientific uncertainty, contradictory information and advice, both from the public health authorities and the scientists. And, let me take the example of the communication of face masks in order to better understand what happened. In the first weeks of the pandemic, the most scientists at public health authorities, including CDC or WHO, said to the public through media that there is no need to wear a mask, even though we had evidence that we must wear masks. After some months, we had again the recommendation that we have to wear masks in order to protect, and in some cases, mask was obligatory measure in order to try to manage better the pandemic. And now, in some countries, again, health authorities and scientists said there is no need to wear a mask. All these messages was disseminated through media that bring, I believe, confusion and mistrust to the public. Let's take another example now. What happened to the public's mind? If it isn't so easy, let's try to make some assumptions. I believe that if we had asked before pandemic an individual who is not scientist, what is science, we will take the answer that science is something clear, it's something certain, it's something undeniable. Let's try to ask the same question now after 2 years and a half of pandemic. So, to answer your questions, I believe both journalists and the public are more conscious now, sure, are more conscious, but I think that they are, we can say, more confused about what is science. I think that now start to understand that science is full of uncertainty, has limits, has statistical errors, has statistical traps, selection bias, publication bias, a lot of limitations of a study and of populations. This is the big problem. We have to communicate to the public and try to educate people not to become epidemiologists. We don't have to educate people to have skills on biology, microbiology, epidemiology, but how to understand science. In this direction, and moving forward, we have, through the journalists and the media, educate people, ask questions about what reads in newspapers or websites. Let's have some example of these questions. Who creates and disseminates science-related information and why? How trustworthy are all these data and informations? How media produce science headlines? At the extent to which the headline matches the content of the story. I think everybody knows clickbait, at how media creates headlines in health issues in order to track attention to websites and so on. What are science facts versus opinions in media stories? What was the original sources of the information? How could one find additional information to add context and additional perspectives to a story? Furthermore, we have to educate people to understand and evaluate information. We have to develop tools. You can see the first example from iMEdD. This is a glossary of common terms for health. This was developed in order to improve common understanding at the language, at critical thinking about what happened in all these topics we are discussing the last 2 days. So finally, I believe that we have to educate journalists in order to understand what is epidemiological methods, what is statistical errors, what is data checking, and so on. So it isn't a simple question, but I think that we have, our role is to try to give the public such tools to develop their critical skills in order to understand the information.
Thank you, Effie. That actually brings up, I think you're absolutely right about the journalist has to play a role in translating what science means. Sometimes it's not for the scientists. I think it's for the scientists, the right experts, to make themselves available. The journalist is the translator, and the public is the consumer. So I wanted to ask Ioanna, actually, as a journalist, do you think there is still, and of course, given your perspective, since you are one, maybe I should ask Effie, we'll see if you agree, is there still a role and a value in specialist science journalists? That industry has been gutted the last decade, cuts all over the place. General assignment journalists have been given science stories. Is there anything special about being a science journalist? Because I previously was one myself. I think it takes a special knowledge, but maybe it doesn't. But what are your thoughts on, do we need specialist science journalists, given all this discussion about helping the public understand the nuances of science and what it is? Can any journalist do that, or do you need special training?
I don't believe that any journalist can do that, but then I do believe that any journalist who wants can be educated to do that job. When I started that job 25 years ago, I was a biologist, and it was funny because in the beginning in the newspaper, people thought that, okay, I wasn't a journalist, and my fellow biologists said, okay, she's not a biologist, so I was nobody really. But the funny thing was that it was very helpful. It was extremely helpful in the beginning to understand what people were talking about, and in fact, the reason I started doing this job was that the leadership came about, and everybody was talking about cloning and stem cells, etc. And it did help to be a biologist, to understand what that meant. My studies helped me a lot during my career. But as I said, I saw many of my fellow journalists in Greece who didn't have a degree in, biology, physics, or math, or anything, to become more and more educated because of the pandemic. In fact, in Greece, there is this class of journalists who cover the Ministry of Health. They are very well versed in public policies, etc., but not necessarily in epidemiology or any disease, really. And I watched every day. We had this information about the pandemic at 6 o'clock, and then there were journalists asking questions. And as the months were going by, I could see their questions were more intelligent, more nuanced, more. In the beginning there was a focus on how many cases or how many deaths, but then they would ask questions about, well, what percentage of positive tests we had in what population, and they would be more and more and more educated. So I do believe the pandemic has created or has educated many fellow journalists. What I'm not convinced is that media owners really know the value of this. So I don't really know how to answer your question. I do believe that if you have a background in any science background, really, and as somebody said earlier, it's important to know how science works, not necessarily to know, and it's impossible to know. People are starting to become epidemiologists for I don't know how many years after the doctor's degree. It's impossible for any journalist to know what they know. But if you know what question to ask and how to be inquisitive about things.
And who to go to.
And who to go to. Don't get me started with who to go to.
No, please get started. That was something I wanted to ask you, of the need for, finding the right sources for your story. It's hugely important, especially in science journalism. There are lots of experts that offer themselves up, but are they really experts? And the stuff you're writing about, people are making life and death decisions. This is people's health. It's their life compared to, I'm not to diminish political reporters or anything, but it's on a different level, I believe. So I wanted to ask you, draw you out a bit on the need for the right experts to engage. What is the responsibility of scientists who have that expertise to make themselves available, because if they don't, journalists will go and find someone who is available. They've got to get a quote. They've got to put that story out. And if the right scientists are hiding from journalists, or they don't trust, or whatever, and that's a whole other issue of can you trust journalists, but that whole dynamic between them. But what are your feelings on the onus on scientists with the right expertise to engage, and the onus on journalists to find the right source?
Well, I do believe that it is the scientists' not obligation, but yeah, as citizens, we have to be there to help. And in times of crisis, this obligation becomes even more important. We did have in Greece this funny phenomenon. Scientists who do know tried not to speak too much because they didn't want to get mixed with all those that speak a lot without having anything to say. And unfortunately, I believe that made a lot of harm. And in fact, I was thinking that, in times of crisis, times of crisis are times of revelation. And for any sociologist to watch how people behave during the pandemic was really interesting, I believe. So scientists and journalists are also humans. So you had the whole spectrum. You had this scientist that jumped into their 15 minutes of the limelight, and they would be there saying what it wasn't theirs to say. And then we had the others that hide it, as I said. And you had others who would do everything to support whatever governmental decision because they had other agendas, like, maybe want to be the next Minister of Health or something. So, and of course others that would make money because they know that, 5 minutes on the TV makes people flock to your office. So you had all sorts of things going on. And they were not all nice. Let's stop here.
Okay. Well, just one follow-up on that. What happened in Greece with the experts? Did a lot of your COVID experts, are they now monkeypox experts?
Some of them certainly are. Yes, some of them certainly are. But I need to clarify something here. If you think how many how many SARS experts were in the world in the beginning of the pandemic, not many really. It was the people who worked with SARS-1 in 2003, and maybe some people who had who worked with MERS, and all these people that they work as virologists that may had some more information. So imagine the difficulty of a Greek journalist who sends an email to somebody, let's say in Harvard or whatever, and this guy is very busy working for this pandemic, and if he has 30 minutes to spend talking to journalists, why he should pick a Greek-speaking journalist? He would choose an English-speaking journalist because the message will reach so many millions. So we did have a problem with that. And not in the very beginning, mind you, because everybody seemed to be awake. There was no sleep in the beginning. I remember getting up early, in the middle of the night to talk to some people in Hong Kong in the beginning because the pandemic was, in Asia. I was starting in Asia. And in the beginning, we had many successes, let's say, in finding people. Thank God I have a colleague that she's really pestering people, and she did have very good successes in talking to international experts. And then we uncovered every Greek person that worked on COVID, because after a while, everybody seemed to be working on COVID, and you did have some people who trusted from before, and people who were doing really great research, let's say in immunology, or, viruses, etc. So we found our way, but, it wasn't always easy. But I have to say that sometimes I wish I didn't see all these people, especially on television, giving the wrong information or biased information, let's say.
Okay, thank you. I'm going to turn to the audience now. We have just over 15 minutes left. So does anybody want to contribute any points to this discussion or ask any questions? We have a lot more to talk about that I could drag out of this lot, if need be, but I'd like to turn it over to the floor. Somebody got their hand up? Yes, if we could have a microphone over there, please. And if you think it's relevant to say who you are or how you situate yourself in this discussion, please go ahead.
Good evening. My name is Eleni Georgiou. I work in the tipping point in education. We had a project with Stavros Niarchos about health, called health literacy. My question is related to what Ms. Gardner mentioned earlier. I think it's closer to what she talked about, and is that what form of scientific content tends to be more effective when informing people on scientific matters, people who have no relation with science or have no knowledge of it? And how can scientists and journalists can work together in order to generate this form of content? Like speeches, infographics, documentaries, what is proved to be more effective? Thank you.
I can start by trying to help with that. So I think one big thing that needs to happen is scientists should be more formally trained in communications, and it is a responsibility, especially when you're talking about something like public health, but really in anything. I mean, we need it in climate science, we need it in all sorts of things that we know there's a lot of misinformation around, a lot of misunderstanding. People need to be better educated from scientists in what science is and how it works, and scientists need to be better at communicating that and their learnings as well. And I think that really some formal training would be great to be a part of that. Like, if you become a scientist, you also get some formal training in how to communicate science. In terms of content, I think, it's true. A picture's worth 1,000 words. And we spent so much time creating visual content to try and communicate complex information as simply as possible. So I think what scientists like to do is they like to make things complicated, and I think what scientists should do is they should try to make things simple. So I think that you want the simplest way to communicate the message, and sometimes that's really hard, and there's a lot of contextualization of things as well. And I think that what happens a lot is that doesn't all get translated. So a lot of times, media will pick up not just, clickbait, but they'll just take one piece of the conclusion, but not the context. And one of the big things we saw, for instance, with this was not communicating uncertainty with predictions. And you saw so many pictures of these curves, right, and predictions of what was going to happen. But those would have, confidence bounds that were huge, that were 100 times bigger than those values. And so I think that being able to really communicate the full picture and the context around these is really critical. But to the extent that you can do it using visualizations, I think is maybe the most useful and helpful.
Thank you. Anybody else? Other question? Okay, well, oh, yes, over here. Has anyone got the mic? Yeah.
Hello. So one question I'd like to make was, so with the pandemic, we saw that this large flow of misinformation caused a large part of the population to lose their trust in front of journalists. So now that the damage has been done in a way, what can journalists do to bridge that gap and possibly regain that trust?
Good question. Thanks. Trust in journalists, or do you mean trust in science?
Well, because the misinformation was mostly about scientific content,
Yeah, trust
then
in
we
science.
see how science journalists have a role to play in terms of that.
Rebuilding trust in science. So maybe Ioanna?
Well, we started with the assumption that trust was lost, but I believe it's more complex than that. It was a very polarizing period, as they said, and I believe that you cannot save anyone who doesn't want to be saved. I'm talking about the anti-vaccine people. I've tried hard. I've tried giving information as clearly as possible, not hiding anything, like, possible dangers or, side effects, etc. But, people sometimes just don't get it. I really don't believe that you can expect that everybody will have the same opinion about the same thing, about a subject at any given time. So what you do is if you're a journalist, what you do is try to be clear and never hide anything and be consistent, and that's it. You can't do anything else. And certainly, whoever believes that it can save, I don't know, the face of journalism or something, I don't know. Big ideas are nice, but I believe small steps, doable steps, are always better. You can do your part, and then, I don't know. Definitely, I'm not sure I can save the world. I'm pretty sure I cannot, but I'm pretty sure I can do my job responsibly, and and maybe help anyone who needs help. But it goes as far as that. I don't believe it goes anywhere further.
I could add one thing that I think scientists and journalists could do, which is, I think, try to be empathetic. And so I think what you said is true, that you can never expect everybody to have the same beliefs on something. And I think that what we do know is that human behavior is really complex. Information and information consumption is complex. Beliefs are complex. And there's lots of different factors driving how people make decisions and what kinds of decisions they make and why they think that's best for themselves. And I think that instead of trying to just force things, I think what we need to do is have better data and better tools and mechanisms to actually understand why people are making the decisions that they do, what are the things that drive that, and identify them and then relate to them and then try and come at it that way. And the problem with that is it's hard, and there is no one solution, that it depends. It depends on what is really driving that person to make the decision that they're doing or have the belief that they have. And we know there's certain things that are really common and there's certain threads that are often there. But I actually think really coming at it with empathy is really important, because it's going to be the only way you're going to have a two-sided conversation. And I think that we know that one-sided conversations aren't going to turn heads and make change. So,
yeah, that kind of leads me on to what you were both saying about getting the right information out there. So, and this is really maybe for Lauren, is have all these personal and sometimes violent attacks on scientists during the pandemic of your colleagues, has it really made them quite wary about engaging? Because putting yourself forward and on the line, sometimes it's had severe consequences. In this environment of non-believers or the politicization of science, it's such an intense atmosphere out there that, I interviewed Tony Fauci recently, and he's, had death threats and, but he has enormous authority, and it was really hard for him to stand fast for science. But, your average scientist, do they have the fortitude with that? And what do you think that has done to scientists' willingness to engage?
It's awful. And I have lots of close colleagues that have been viciously attacked for just trying to communicate. And so it not only pulls back some of the best minds from speaking publicly because they literally get death threats and have to have security around their families, but it makes their other colleagues that are also really good scientists not willing to come forward. And that, you know, at the start, there was a lot more faces. And so one of the things that I actually think optimistically was great about COVID is in the first few months, when you turned on a lot of news channels, at least, you actually did see experts speaking about science rather than, you know, celebrities or something, which was actually a really great, refreshing
yes, that
change.
actually was a relief because it could have gone that way, definitely.
But absolutely, I think that these kind of attacks, which are really, really harmful and are pushing scientists away, the good ones often away from the spotlight and bringing the wrong ones into the spotlight. So.
And hopefully we haven't got anything too terrible to look forward to. That's obviously an area of work. We have another question from the audience. Please go ahead.
Hi. Hello? Yeah, there we go. Tim Schafer, the SNF Chair for Civil Discourse at the University of Delaware. So I study communication and democracy, and so I've been thinking, actually, Dr. Gardner, one of your comments earlier about the sense of complexity and simplicity. I believe you were the one who said that. And just before traveling here, spoke with a colleague who studies local media and was making the point of the consolidation of how a lot of people still consume local media, particularly in the United States, and I'm not sure about other contexts, as a primary source of information, local nightly news, those sorts of things. And those are environments where we would see the simplicity story, right, of here's your, do this thing, here's your result. And during COVID, we've had that continue as a primary kind of channel for that information. So I'm sitting with this is both a kind of statement, more of a question. I'll raise my voice at the end to make it more of a question. But what do we do with that tension between giving the more simplistic, helpful, accessible, publicly consumable, understandable information, and at the same time acknowledging that it is a moving target. There are factors that come into play, as we were talking, as you were mentioning earlier, of the efficiency of getting information out, but that gets, there's a trade, right? It's not going through the review process and things like that. So, is there a point to where we need to not make it so simple, to where we have the potential of losing the clarity? I have pocketfuls of masks, right? And this is the first time I've been out in the world literally without wearing it constantly, and it feels strange. But I remember that first moment when we had that discussion of, we're going to need to wear these things, so this will be sufficient. And then after the fact, we realized that, well, this wasn't quite as effective as we thought, and some people just absolutely dismissed it. And meanwhile, I just figured out how to reuse this bag of cloth masks that I have, and now I've got my KN95s. But so where do we think about that tension between that simplicity of message, communication, particularly for those in these formal roles, such as journalists, and also acknowledging that it needs to be, not just lost in the, well, it depends, or it's not, what do we do with that tension?
Okay, great. We're down to 3 minutes.
I wish you well.
It was directed at Lauren, but I think Effie, you might also have something to say about communication theory as to what to do with that. But Lauren, do you want to go first, and then Effie?
I'll be quick and hand it off. I think I would say
56?
it's got to come from both sides again. Critically, I would love to see improved science literacy in non-scientists, in the general public. Journalists for sure, but that's a bit of like a professional responsibility. But I think everybody needs to be more educated in science itself and how it works, and the fact that it does change, and that the fact that policies changed in response to science doesn't mean it was bad science. It actually is better, and that's good if that's happening. And I also think that we have to be open to things not being so simple, that things should be contextualized, that things are unclear, that you have to be more accepting and open to uncertainty, because that's also a part of science. So I really think science literacy is at the heart of this problem.
Effie, the balance.
There is a lot of guidelines how to construct a simple, clear message to the public. Probably our efforts must to be in these directions to educate journalists or scientists too, to speak plain language to the public. We have a very good example with pandemic, but medical terminology, it's scientific terminology, it's a problem in general, how people understand all these medical terms, science terms. So there is a lot of guidelines from CDC, from public health authorities, public health organization has published a report about infodemic and how we can convey messages to the public that we can use in order to communicate and disseminate scientific information to general population.
Okay, thank you. So we've got 45 seconds left. I'm going to wrap it up, but I'm going to leave you all with a question. Oh, was there one more question? Okay, can we do it in 30 seconds?
I wondered if the panel could speak to us about censorship and whether any of that came from your institution or the government in your reporting. Sorry, I had raised my hand like 10 minutes ago. In your reporting around COVID or other health reporting, I mean, we just heard about maybe the public doing some censorship of scientists and these attacks, but I wonder, we hear about censorship in other issues. What can you tell us about censorship around your health reporting or COVID reporting from institutions you're in?
Thank you.
Or governments?
One sentence, sorry guys, but
no, actually, we didn't, but then I can only speak for the media I work for. I don't, no, not necessarily. But then again, I would never put an anti-vaxxer in a page of mine, so you can talk about censorship. I don't know how you, how to respond to that, but then I made that conscious decision that we don't need people who do harm, and I would never ask them, and I would never put them like side by side with a real scientist. Then yes, I practice censorship in that way, if I answer your question. But I was never taught what to write in the media I work for.
Okay, I think that's it. Thank you so much. Sorry if there were other questions we couldn't get to, but thanks. I do have something I want to leave you all with that I hope that you'll discuss outside of this session, maybe in the coffee break, and that is, now that scientists are not confined to newspapers and journalists, they don't have to go through journalists, they can talk direct to the public these days. Does that make things better or worse? I thought that was something you guys could discuss over coffee. So, or maybe it doesn't make any difference, but food for thought, coffee for thought. Thanks so much. I think